Kia ora koutou, everybody. Thank you for joining us. Unfortunately, our regular providers haven't been able to provide sign language interpreters for today's event, so closed captioning is available on the Ministry of Health's live web feed, but we'll also be making a full transcript of today's press conference available on the Ministry of Health's website as soon as possible after the event has finished. At 1 o'clock today, the Ministry of Health will release its regular update, its regular daily statement, and that'll outline New Zealand's key COVID-19 statistics from the last 24 hours. But ahead of that statement being released, I can confirm that today's community case total sits currently at around 5,000 cases. That's a mix of PCR tests and rapid antigen tests, so can I thank those, there's over 1,000 rapid antigen test results in that, so can I thank the people who have been uploading those results.
Can you give us a specific number?
Well, they'll be in the 1 o'clock statement, the specific numbers. They're being finalised at the moment. Following on from 3,297 cases yesterday and 2,846 cases on Tuesday, this continued rise and also the number of hospitalisations we have, which today sit at 205, means that we are now confirming our shift to phase 3 of our planned Omicron response. That will happen as of 11:59 p.m. tonight. We've continued to monitor the outbreak very carefully and to consider the public health advice that we've been receiving before we've come to that decision. With the numbers rising sharply over the last week, as we expected that they would, I don't think the shift is going to come as a surprise to many people. Most people have been preparing and gearing up for this moment. Details of the changes and what they might mean for you are being provided on the Unite Against COVID-19 and the Ministry of Health websites. They'll be available from this afternoon. However, I do want to provide a reassurance that phase 3 won't mean any sudden lurch in terms of personal restrictions or movements. That's because our traffic light system has been specifically designed to smooth out these kind of processes. We want to move through the phases seamlessly and relatively smoothly, which is what we've been doing, but we're aiming to keep people safe with as little disruption to their day-to-day lives as we possibly can have. So our priorities now shift to isolating those with COVID-19 and their household contacts to reduce the spread, while at the same time supporting supply chains and essential businesses and services to continue to operate. So we'll do this, in order to do this, there'll be a number of changes that you'll see when we move to phase 3 from midnight tonight. Only confirmed cases and their household contacts will be required to isolate. So I'll run through that again. It will only be confirmed cases and their household contacts, the people who they live with, who will be required to isolate. All other contacts will be asked to monitor for symptoms, but they do not have to isolate. Rapid antigen tests will become the primary means of testing for COVID-19. They'll be available through thousands of sites around the country, including pharmacies and GP practices, and we've got millions more of them arriving in the coming days. Major shipments are due today and over the weekend. We expect businesses to be able to make rapid antigen tests available to the public for purchase through retail outlets from March. We'll have more details of that in the next day or two. We're also now moving to the stance of greater self-management when it comes to COVID-19. That includes the use of new self-investigation tools, which will support positive cases to self-notify their contacts. Because only household contacts are required to isolate, the tool will help us to keep track of exposure events and locations and the overall spread of the virus. Contact tracing teams, though, our teams, will be focused on identifying and tracing those who have visited very high-risk locations, such as a hospital or an aged care facility, and there will continue to be support for those members of our community who aren't digitally set up to engage in that way. Hospitalisations now become a major focus, and daily case numbers will become a less important metric from this point onwards. This is critically important. Practical changes to ease some of the pressure on our health system over the next 3 to 6 weeks are have been driving the changes that we've been announcing today, and that ensures that we can keep critical services and supply chains remaining operational and keep our economy moving as well. So there's no doubt the next few weeks are going to be pretty challenging, but New Zealand's better positioned than most countries to respond to Omicron. We will get through this. We've seen and learned from what's happening overseas. We just need to stick to the plan that we've set out as we manage higher number of cases in our coming weeks before we will reach a peak as other countries have. Because so many New Zealanders are now vaccinated, and because Omicron has a less severe reaction or triggers a less severe reaction amongst many people, we can have that more devolved response, placing a much greater emphasis on self-management, allowing our teams to focus more on the vulnerable and on the most vulnerable. Preparation and supporting will be a key for many people. We've been asking people to prepare for the last few weeks, both mentally and also by putting their plans in place. So making an isolation plan, having their stay-at-home kit ready, talking to their friends and whānau about how they will manage through if they and their household needs to isolate. Our high vaccination rate should also help us through the next period. We still strongly encourage people to get their booster doses if they have not already done so. We're currently nudging around 70% of people who are eligible for a booster have either taken one up or who have booked in. So there is still room there for us to get ourselves even more protected in the coming days by people taking up their boosters. You are far less likely to end up in hospital if you get COVID-19 if you've had a booster, and the Director General, I know, can speak more to that. Care and support will be available in the community for those who need it most, as it always has been, and our community providers being resourced to provide care in the community and wraparound health and welfare services alongside clinical care for those who have higher needs. So whatever phase 3 might mean for you as people, as businesses, as organisations, as communities, I want to reinforce that we have carefully planned for this, and that New Zealand is in a much better shape going into the potential peak of Omicron cases than many other countries. So keep supporting one another and we will get through this. With that, I'm happy to.
Minister, we go into phase 3 in a few hours' time. Why aren't all of the places that can stop rats not overflowing in preparation for this? Why don't we not have enough stock for people so that we can kick in a few hours' time?
We've certainly been making sure that we're getting test results out, test kits out there and distributed around the network. And I'll get the Director General to comment more on that in a moment. In fact, I realised I didn't hand over to you because I'm a bit discombobulated being in a different environment. So I'll finish answering your question, then I might get the Director General to say a few words before we get into question and answers. My apologies, everybody. But we have distributed rapid antigen tests out throughout the network. We've got more arriving by the day. We are preparing to be able to make them available through retail sales, or to remove the impediments for people to be able to make them available for retail sales. And we might want to come back to that in a moment. But in the meantime, I'll just
Can
have
I
the
ask a follow-up question on
Yeah.
that topic? Is it good enough to say to people, don't worry, more on the way when we're going into phase 3 in a few hours' time?
Look, they're available for people who need them. They're available for people who need them now to get tested. They are available through the testing network.
Sorry, this is a very obvious follow to that. We've heard this morning that there is a testing centre in Auckland and Northcote that has been turning people away because it doesn't have enough rats. Why don't community testing centres have enough of those tests?
Yeah, and the Director General can provide an update on that specific case. My understanding is that more tests have been supplied to them. We are seeing, of course, a big surge in demand for testing, so making sure that we're getting tests in the right places. The last thing we want is people sitting on big stockpiles of them while there's more demand elsewhere. So getting them in the right places is always going to be a bit of a logistical challenge. But where centres are running out, we're getting more to them as quickly as we can.
How many rats are in New Zealand at the moment?
I'm happy to. Well, thank you, Minister, and welcome to the Ministry of Health. Welcome back to all of you to the Ministry. Kia ora koutou katoa. So I will cover off, perhaps I'll make my opening comments and I can respond to some of those anticipated keen questions about rapid antigen tests. But just to start with, one of the reasons we've advised the move to phase 3, and as the Minister's suggested or hinted at, around 5,000 cases at least, a combination of both PCR confirmed and rapid antigen test confirmed cases today. There is increased demand for testing, and the planned move to this phase 3 and the planned move from PCR testing, which has happened over the last couple of days around the country, especially as demand has grown and case numbers have grown at community testing centres, and rolling out more widely over the coming days to general practices and a range of other places, will help ease the pressure on our laboratories so that our PCR testing will be used for people who are unwell or more susceptible, for example, in those who are in hospital, people who are immunocompromised, pregnant people, others for whom it's very important in terms of clinical management to have a specific diagnosis. To speed up the testing process, both symptomatic people and asymptomatic close contacts whose rapid antigen test is positive will be considered a case without the need for a confirmatory PCR test. And again, just to reiterate the Minister's comment, thank you to the people who have already started uploading their positive rapid antigen test results onto my COVID record, and we will be incorporating those into our daily numbers from here that we do report. People should also advise their employer of their positive result, of course, so that appropriate measures can be taken to identify any potential contacts in the workplace who may need to consider their own movements and so on. Now, rapid antigen tests will continue to be used for critical workers who are household close contacts to help support them to return to work if they need to, if they are critical workers. So recalling that at the moment, both cases and household contacts need to isolate for that 10-day period, but household contacts who are critical workers, who are asymptomatic, will be able to still use that exemption scheme and use rapid antigen tests to be able to go back to work. We'll also be following up any rapid antigen test positives we get from people who start coming across the border and with a PCR test. This is so we can do whole genome sequencing if they are positive, and this helps with our ongoing surveillance at the border. Now, businesses have been able to import rapid antigen tests since the beginning of December, and we know businesses, however, like ourselves, have had challenges in procuring supplies because of global constraints. Those are easing, and as the Minister said, we have large supplies now starting to arrive over coming days. There may not be rapid antigen tests on shelves immediately, but they will be available soon in retail outlets. Likewise, in Tamaki Makaurau, general practices and urgent care clinics will begin to roll out supervised rapid antigen tests from today. The important point here is to find out whether or not your general practice has got the tests and is it doing this. Check on the HealthPoint website. That will have an up-to-date list of all the places you can get a rapid antigen test. We do have enough in the country to help us through a widespread Omicron outbreak in coming months. 1 million more. We had 6.3 million unused tests yesterday. 1 million arrived last night, and there is another 4 million arriving today. And again, further shipments coming over this coming week, with around another 10 million at least arriving over the next week. We are getting them out to places, but as you know from demand on certain supermarket products at times, there can be a mismatch between demand and supply. And in the case of the centre in Birkenhead in Auckland, yes, there was a shortage and more stocks have been supplied there. I should say one of the things we are trying to anticipate is also the impact of people being cases and contacts on supply chains and logistics like courier companies, and so we have got the rapid antigen tests as dispersed as possible through the system. Just on isolation and why we're moving to just household contacts, we know that with Omicron, as with other prior variants of the virus, household contacts are by far the most likely to become infected as secondary cases, and that's why in this phase we are focusing now just on household contacts isolating. So as the Minister said, from tomorrow only cases and their household contacts will be required to isolate. Now, while other contacts will not be required under the Section 70 notice to isolate, clearly it's important that people know if they have been in contact, and that's why we're asking cases to self-register and let their contacts know, because they may need to take appropriate precautions. They may need to let their employer know if they're a critical worker, for example, and likewise they may need to for example, modify what they do, not visit older relatives or people who may be susceptible if there's a risk they were a contact. And for everybody, for all of us, this is a time to be really mindful about who you visit over these coming weeks. And it's not the time to go and visit older relatives in aged residential care if you might have been a contact. As we did early in the pandemic, act as if you have COVID and look to protect others around you. Remembering that over a third of people who are infected with Omicron, if they're vaccinated, will not have any symptoms. So it's important we all do our bit there. Boosters, the Minister has mentioned, and what I just want to focus on with my brief comments on this today is our modelling of the low transmission scenario, such as the one that Dr. Gary Jackson at Counties Manukau talked about yesterday, assumes high rates of booster uptake. At the moment, nearly 70% of eligible people have done so. We need to increase that, and recently published evidence just in the last week from studies by the CDC in the US show yet another reason why this is important. There has been some question about whether the vaccine, even people who have had 3 doses, protects from either being infected or from transmitting to others. There are 2 new studies from the American Centers for Disease Control and Prevention that now confirm the vaccine protects against getting infected in the first place, and it's hard to pass the virus on if you're not infected in the first place. And just as that we know, they protect against severe illness. And this is quite profound. One of the studies, which was published in the Journal of the American Medical Association, shows that compared with being unvaccinated, the odds of contracting Omicron after receiving 3 doses dropped by 67%, 2/3, and for Delta the risk declined by a stunning 93%. So yes, 3 doses of the vaccine doesn't just protect from hospitalisation and death, it protects people from being infected by Omicron in the first place. So a highly boosted population here will serve us all well. Finally, just to let you know that our health sector has been working hard over the last few months to get prepared for Omicron. There's been a lot of work undertaken by district health boards, by our primary care providers, by community providers. All DHBs have plans in place. You will have seen the hospitalisation number at the moment, over 200. Now, that's a significant impact, but our hospitalisation rates across the country are on average 85%. That's about what they usually are. ICU occupancy is about 62%, so we have capacity in the hospital system, but we want to try and keep the hospitalisations down as low as possible. Even now, with over 25,000 active cases, the hospitalisation rate is less than 1%, so it's much lower, but the number of active cases will drive our hospitalisations. If you are unwell for any reason, you should and can safely seek care throughout the health system, and that includes inside our hospitals. Back to you, Minister, I think, for all the hard questions now.
Minister,
We'll have another go. Sorry about that. Right.
When planning these phases out, you had household-like contacts as having to isolate in phase 3. What's happened there? Why is it now only household contacts?
We're trying to make this as simple as possible. We don't want there to be confusion about who needs to isolate. And so we've worked really hard over the last few weeks to make sure that we're getting this as clear as possible, so that people really understand whether they need to isolate or not.
But for some people in workplaces, if you're sitting in a small, warm office, that's just as likely that you'll pass it on or catch it from them as you would as someone living in your house.
So I think it's important to note that this is who is required by law to isolate. That doesn't mean that people who feel that they have been exposed shouldn't isolate if they're in a position to be able to do that. This is who is required to isolate.
Yes, but that's quite a dangerous, especially when we see, especially in, say, Pacifica households where we've seen families over-isolate, so isolate to an excessive extent when we don't have clear communication. So is it appropriate to be sending a message, you can judge how far, when you want to isolate, how you want to do that?
If you are a household contact, you have someone in your household who has COVID-19, you are required to isolate. If you have a friend who has COVID-19, you can make a judgment about whether you think that you would be at risk based on the nature of the contact that you've had, or a workmate based on the nature of the contact that you have had. We are moving to a position now where there will be a much greater number of COVID-19 cases in the community, and we are asking New Zealanders to accept a much greater degree of personal responsibility for what they do around that.
The Nurses Association says they've been told if a nurse tests positive, but as long as they're asymptomatic, they can still go to work. Is that correct, and is that safe?
I'll get the Director General to comment on the workforce guidance.
So we have a specific scheme in place for healthcare workforce if they're a critical worker and it's essential that they are able to work to keep a service going. They cannot go back to work for the first 7 days, but if they return a negative rapid antigen test on days 5 and 6 and are asymptomatic, then yes, they can return to work 3 days earlier than the full 10-day isolation period.
This is perhaps a question for you as well around schools. What's the guidance for parents about sending kids to school?
You mean if those children are...
So, because at the moment, if it's only household contacts,
Yes.
let's say if a child's in a classroom, can you just give parents the message of what they should be doing?
Actually, I think the Minister of Education is very well placed to respond to that question.
Again, it is household contacts, people who live with someone who has COVID-19 who need to isolate. I acknowledge that schools will also want to know what they need to do about this. Detailed guidance will be sent out by the Ministry of Education to schools as to how they work through this process. But the fundamental, premise remains the same, that if you've got someone in your household who has COVID-19, then you're required to isolate. If you are simply a broader contact of someone who might have COVID-19, you are not required to isolate. But parents, I'm sure, will make judgments about that. I know that schools will make pragmatic decisions about, for example, how they code student absences, where this is the driver behind student absences. So schools are well prepared to work their way through.
Doesn't this create such a two-tier system, though? If you've got parents who can afford to take time off work and keep their children at home, they have such an advantage compared to other kids where parents may be in a job where they can't take time off and their kids have to go to school and there's no requirement for them to stay at home.
Look, as a parent, I can tell you it has always been that way. COVID-19 or other illnesses, when it comes to child illnesses, or children having to stay home for whatever reason. And schools, certainly, and early childhood services at the moment are certainly taking a very kind of low tolerance approach. So kids who show symptoms of any sort are being asked to stay home. Actually, that's good practice, even if we weren't dealing with a potential peak in COVID-19 cases. And I acknowledge that puts pressure on families, and some families are better positioned to be able to do that than others. It is one of the features of being a parent that when your kids get sick or when your kids have to stay home, you have to find ways of dealing with that.
The
I have 2 questions for the Director General, if I might.
Yeah.
Can you explain, because obviously a lot more people are getting COVID-19, the health workforce is the same size. Can you explain, if I was to contract COVID-19, how I would be told, how I would be triaged, how I would be cared for, how do you discern people that are going to be fine at home and people that are going to need hospital level care?
Yes, so under phase 3, this is similar to what it was under phase 2, and we did a briefing on this last Wednesday. Essentially, and it's already started under phase 2, many people will be self-managing. So to date, because most of the testing has been PCR, people have been notified since we started phase 2 by text largely, and then a link for them to fill out a form and provide their information. And on the basis of that information that's provided, there's follow-up to determine what clinical or social support they might need if it's indicated. As I say, for the vast majority of people, that is not the case. So that continues into phase 3. For people who don't respond to that text, then there is a mechanism to follow those people up with phone call and other ways to try and contact them to determine whether or not they require any clinical or other support. For people who are uploading their tests onto My COVID Record, because it's a rapid antigen test, likewise that test then goes into the system, and there's a process whereby they will be able to identify whether or not they need any clinical or social support to isolate.
Can I also ask, Delta is still circulating in the community to a smaller extent. Can you advise whether it's appropriate for Kiwis to act like they might get Delta rather than Omicron, what the likelihood of that is, where it's circulating?
To be honest, I go back to my comment that actually everyone should act as we did earlier in the pandemic. You'll remember this specific call. Act as if you might have COVID and behave accordingly to protect others, including using masks and so on and so forth. It doesn't really matter whether it's Delta or Omicron, although we do know that there's a higher risk of Delta causing people to become unwell and end up in hospital. We are still doing whole genome sequencing of all our hospitalisations, and probably within the next few days we'll have an indication of just what the balance of hospitalisations is between both either Delta or Omicron variants, and that will give us some picture of then what the circulation of Delta is in the community still.
Is the protesters now being deemed
You've been asking for several weeks now, and the Ministry of Health have been asking for several weeks now for people, particularly in Auckland, not to get tested if they don't have symptoms, if they aren't a close contact. Do you think that message is getting through? Have you seen that reflected in testing numbers, or are people still turning up at testing centres and using up resources that could be free for people who need them?
We are seeing that message getting through, and we also saw yesterday the impact of starting to roll out the rapid antigen tests in Auckland, so about 40% lower number of swabs taken yesterday for PCR tests across Tāmaki Makaurau, and I think around 14,000 rapid antigen tests handed out. But what I would say is, for all of us, the message has been for the last 2 years, and it's served us very well. If you have any symptoms, or if you might have been in contact, then go and get a test. So everybody is having to make that shift. I think that shift is now happening, and of course the use of rapid antigen tests will really support us to make sure we can maintain our PCR and laboratory capacity.
But is the alert level system to the traffic light system, red, orange to red, phase 1 to phase 2 to phase 3, quite rapidly in succession? Do you think that people might be getting rules fatigue and not be able to keep up with each changing thing around who has to isolate, how you get a test, what kind of test you get, that sort of thing?
Well, a comment from me is the reason we keep doing our regular briefings and put out our releases is to try and be as clear as possible, and also the material on our website. I agree. I think especially with this outbreak, it has been a rapid rise over this last 2 weeks, and so we've seen these transitions happen probably quicker than we might have anticipated, but we've tried to be really clear, including by laying out right at the start what the 3 phases were, and then making sure people are aware of what the requirements are very clearly.
I just wanted to ask about people who are existing close contacts under the rules that exist right now. Do those close contacts, do they lift at midnight?
Yes, they do. So just as when we shifted from phase 1 to phase 2, the new rules came into play, that will be the same tomorrow for people who are currently isolating as non-household close contacts under the phase 2 rules, as it were. But so saying, of course, we're encouraging everybody, whether they're required to or not, to just be thoughtful about the risk they might pose to others and take appropriate precautions.
Just an example of that, though, I just wanted to ask. So the protest of Parliament, everyone who's there was deemed a close contact as of 20 minutes ago, or about 30 minutes ago. So in 11 and a half hours, those close contact kind of statuses disappear. What would you expect those people to do?
I would expect them to do what we're expecting of all New Zealanders, and that is to essentially do the right thing to protect other people. And that's the reason we've done well to date, is because New Zealanders have done that actually. Regardless of what the rules are, it's still relied on a high level of trust and confidence that people will do the right thing, and they have. And of course we'd ask the same of anyone who's at any location of interest.
How many cases are now?
Hipkins.
Why don't we just get any more questions for the Director General, then I'll come back.
How concerned are you about what's happening down the road? You have a big group of people yelling, singing, no masks, all close together.
I'd be as concerned as anyone else, because we know exactly the sorts of things that are likely to spread this virus, and so it puts people there at risk. And some of those people, especially because we know there are lower vaccination rates, will get unwell, and particularly unwell, and that to me puts them at risk, and so I'm concerned about that.
There were 2 cases yesterday. Do you know of any more today?
I don't know of any more confirmed cases, but if we get an update on that from the local public health unit, we will provide that update.
Was there someone who was connected to the protest who turned up at Wellington Hospital yesterday who was sick? Have you been made aware of that?
Well, we have seen reports that there have been people who have been at the protest who have sought care at the hospital through the emergency department, most likely because they are away from their usual place of residence, so they've sought care there. Yes, and so there have been people who have been at the protest and have turned up at the hospital and have, because everybody going through the EDs at the moment is being tested, they have tested positive for COVID-19. What I'm not sure is whether they sought care because of COVID-19 related symptoms or for another reason.
So how many people from the protest have turned up at the hospital and subsequently tested positive?
I don't have an exact number on that.
What work has been done to establish case ascertainment rate?
Well, this is something we're looking at. So we're now at this point in phase 3 where we will start to use a combination of data sources to see what our case ascertainment rate is like, and that includes how many people in hospital, which I've talked about, and at the moment our hospitalisation rate is similar to what other countries have seen with Omicron. Obviously our PCR and our RATS tests combined, but also this is where not so much to quantify case numbers but to look and see where different areas are. The wastewater testing will show us whether case numbers are increasing or declining, but we won't have a full picture of the total number of cases. You're right, there will be cases out that don't ever make it into our official numbers, but all these things will help us get an estimate of just what the total burden could be.
We've had experts talking about the need to determine that rate. You know, colleagues over in Australia, I'm told, had to do that work during their peak, which made it incredibly hard to do so. And essentially experts are saying we need to get that rate ASAP to be able to understand exactly what we're dealing with before we hit mid-March, late March. So do we have an idea about when we're going to understand exactly how many cases or how many infections we're going to have across the board?
Well, 2 comments here. One is we have our modelling, and that has shown us what we might expect based on a number of assumptions and inputs. But secondly, as the Minister mentioned, actually what is important is our hospitalisation numbers and the impact across not just our hospitals, remembering the vast majority of people who need clinical care will be just looked after by their GP or other clinical providers.
If we have that rate, we can then predict what populations, what communities, what areas are going to be hit harder by that, and then we can look at resourcing those areas.
I think we've right through the pandemic used our testing rates and our analysis of what the epidemiology is in different areas, and we now have an epi curve for each DHB each day, so we can see what's happening in each DHB. So yes, this will be important, but what I would like to say is it doesn't require us having an exact picture of the number of cases out there. We will be looking at a range of metrics to help us manage our way through the next 3 to 4 weeks.
Minister, for rats and mart, can you just clarify, and maybe it's not for Dr. Winfield a little bit as well, why would someone buy one versus getting one from a pharmacy? Would that be for surveillance rather than being in close contact or having symptoms? And are you putting in any measures to stop massive price rises? Should people who have money really be able to surveil themselves to COVID and people who aren't?
So first message, those who are required to be tested, those who we need to be tested, will have that test freely available. Those who want to test for other reasons, we will be looking to remove the barriers to them being able to purchase their own tests. And we'll be looking to do that very quickly.
Will you have any controls on prices, or will people be able to buy the tests, buy them up large amounts of them?
It'd be fair to say we're going to keep a very close eye on what is happening there. Our retailers in New Zealand over the course of the pandemic, I think, have on the main been very responsible about not price gouging when they've had the opportunity to do that. Where a whole variety of things have been in very short supply, but we'll be monitoring it very closely.
So, Minister, while you're still there, can you just clarify why on earth you are stopping people at the border right now, given there is 8 cases at the border in the last 24-hour update we got yesterday, compared to 3,000 cases inside New Zealand? Is there at this point, given Omicron is here, any real moral or political justification for stopping New Zealanders coming home?
So look, we are days away from the border, beginning its reopening for Australia, and then very shortly thereafter followed by the rest of the world. We are reviewing the self-isolation requirements for people coming into the country. I don't have an announcement to make on that at the moment. We're getting advice on that about whether people should still need to self-isolate on arrival in New Zealand. We expect to get that advice in the next week or two. and consider that, and then we'll make further decisions based on that.
Right, so there's a chance that self-isolation could be completely gone within the next month.
Within the next month, we'll certainly maybe be making decisions on that.
Probably more a question for Dr. Bloomfield. How many DHBs have had to make significant deferrals to planned care because of the Omicron outbreak?
So at the moment, the only one I know that's made significant deferrals is Auckland DHB, and even in the Auckland region, which was clearly it has been the hardest hit, the other two district health boards are still doing about 70% of their volumes. At the moment, I'm not aware that other DHBs, because if you look at the hospitalisation numbers, are actually small relatively relative to the capacity in the DHBs. The key thing that tends to drive them needing to either defer to defer planned care will be staff, if there are staff who are offered because they're cases or contacts.
And you haven't been made aware of major staff disruption because of cases in other DHBs?
Not at this stage, but they all are having staff disruptions. I think to say that they are interested in and supporting not just disruptions because of staff challenges inside their DHBs, but also out in the community, and particularly in aged residential care. So they're all working closely with aged residential care to make sure that that is an area they're supporting if they needed to.
And given the number of cases that we've seen in schools, does the gap between the first and second doses for 5 to 11-year-olds need to shorten from 8 weeks? Or has that been considered?
It's already been considered, and we've asked for specific advice on this from our technical advisory group, and they've provided advice now that we should maintain the 8-week gap. There is a good reason for that, and that's why you're seeing most countries who are vaccinating 5 to 11-year-olds are maintaining that 8-week gap, because children, because of their much more attuned immune systems, have a much starker response to that first dose, and then it's also a bigger gap is better for long-term immunity and for reducing the likelihood of some of those rare side effects.
And do you think we will get to phase 4 of the Omicron response, and when, if you expect that we will, when do you think that will happen?
Well, I don't think so, because I don't think we've elaborated a phase 4 yet, Mr. No? Yeah. No, just 3, I hope.
Yeah.
Yes.
Do we still need to scan if it's only your household contacts?
At this stage, yes, it is still helpful to scan. And what I would say there is people can still notify their non-household contacts. Again, I think that's an important point here. The difference is that those people are not required to isolate. But I think it's really helpful for people to know if they have been exposed, because then they can act accordingly to protect others.
Where are we at with Novavax in terms of the approval?
Yeah, we've had advice. I've had advice from the scientific advisory group. I've passed that advice through, and ministers are, I think, close to making a decision around that.
When you say close, days?
Can I note, at this point, Novavax has only been approved as a primary course, and of course we've got 96, heading on towards 97% of eligible New Zealanders have already completed their primary course. So it's a very small number that we're talking about here. We're working, there's 2 things. One is the decision to use that has to go through a cabinet process. That's not far off. The other is just securing a supply. One of the issues here is we want to get enough that we can make it available. We don't want to get so many that we end up with a whole lot that we can't use, because that's not great either. And given we are talking about potentially only about 3% of people who could use it was not approved to be a booster at this point, then balancing up all of those things. So we're not far away, but we're just not quite there yet.
Do you have any numbers on how many people are isolating at the moment? Is that data that we collect?
Yes. We've got a bit of a picture through our contact tracing teams who are actually following up, I think at least 15,000 people who are identified to be self-isolating. But what I'll do is we'll make sure we get the numbers out around who's on our system. There will be others who are self-isolating that are not necessarily in our contact tracing system.
Minister, just a couple of questions. On MIQ, could those travel dates be brought forward at all?
We've always left open the possibility of that. In terms of the dates over the next 3 weeks or so, what we know from previous experience working with the airports and with the airlines, they need a reasonable amount of notice period. So if we were going to be shifting any dates, it's likely to be some of those later dates rather than some of the earlier dates, simply for logistical reasons as much as anything else. With with the stepping out of the changes already announced and already being planned for, you will see quite a lot of change in the next few weeks, including some of the people who have been seconded from other jobs into MIQ, for example, will be returning to their more regular roles. So we're talking about ABSEC, police, defence. They'll be returning to their more regular roles as MIQ starts to reduce very steeply over the next few weeks in terms of the number of people who are in it. So we're now in that process. The next couple of weeks are pretty well mapped out, but we've always been open about the fact that some of those further afield dates may well change.
Things have moved pretty quickly from phase 1 to phase 3. For many New Zealanders, I guess, will be feeling a little bit anxious with the fact that COVID is effectively around the corner now. You don't know where you're going to catch it. What is your message to them?
Keep calm and carry on. Follow the advice and follow the guidance that you're being given. So if you have COVID-19, then stay home. Get your household contacts, the people who you live with, to also stay home and follow the guidance that you are given. If you think you might have been exposed to COVID-19, then we're now asking you to take personal responsibility for what you do in response to that. And look for the guidance that's out there. And follow that guidance.
And just as Education Minister, just on the vaccine mandates for kids at schools for sports, when are those restrictions going to be removed?
We're just working our way through exactly how to provide greater clarity here and exactly where the line gets drawn, because no matter what you do, you have to have a line somewhere. So we're just working through the details of that. At the moment, I absolutely acknowledge there are some inconsistencies that are quite stark. So you can be playing a game of sports at lunchtime, but the exact same game with the same people in the same place couldn't take place at 3:05. And so we want to work through that so that we're ensuring that all kids can fully participate in school life. There are still a few issues to work through around the interaction with things like club sport, for example, so we've got to work our way through that, but we want to provide clarity. I envisage that's not far away. Within the next couple of days, we should be able to provide that.
Just one more on that. Did you get it wrong when it came to these restrictions?
No, I think that they've just been interpreted in a way that has meant that some things are being captured that we didn't expect to be captured.
Minister, have you given any thought to a system, in addition to or instead of allowing private sales of rats, a system like the UK where you can get 7 tests every 3 days, everyone can do it for free, and in Scotland people are advised to take 2 rats a week regardless of whether they have symptoms, and to take them before they go socialise. It's just a much higher level of surveillance to actually catch, not every case, but do a lot better of a job. Have you given a thought
look,
to the system?
at this point I'm really comfortable with the testing arrangements that we're putting in place. I wouldn't rule out in the future making tests more widely available for other purposes, including more surveillance, but not at this point.
So will there be a testing requirement for household contacts?
Yes.
Of those
Yes.
cases?
Yes.
So when will they need to be tested? And can you explain a bit how the self-release after 10 days happens? Does the case need to have a test to kind of confirm that they're okay? Or do they just, after 10 days after they test positive, they're good to go?
Yeah, so a case can release after 10 days, so they don't need to have any test to release. They can self-release, and likewise household contacts will be required to have a rapid antigen test day 3 and then day 10, and return a negative test and then be released. If either of those are positive, or if they're symptomatic and return a positive test, then they isolate from 10 days from that point.
When you say March for buying rats, do you mean March 1?
I said from March. I haven't put a specific date on that, but as I've indicated, I expect that process to move quite quickly from here. So I'm expecting to get some paperwork on that in the next 24 hours. May even be at my office already, may have arrived in the last few hours. I think things will move quickly. Of course, that's on our side. That's in terms of the regulatory side. How long it takes for those retailers to get supplies, of course, is not something that we can necessarily control.
Just back on the protest, will the self-isolation requirement for protesters, will that be enforced, and how would you enforce that? And also, does that affect the cops who are on duty at the weekend? Does that mean that hundreds of them have to go and self-isolate?
So remember, phase 3, what we're looking at is people who live with someone who has COVID-19 are required to isolate.
There's still a day before we move to that.
Well, it's as of midnight tonight.
But what does that mean for all the cops who were on at the weekend? They have to
Well-
leave and isolate in a hotel room for the rest of the day?
They'll be following the guidance that they are being given. Yeah.
On the rats. So can you pledge that rats will be available to buy before the peak of this outbreak or not?
Well, we don't know when the peak of the outbreak might be.
Well, indeed, because you haven't got organised and get the rats in on time.
Well, no, I don't think I don't think that's fair or true at all. We've got rapid antigen tests available for the people who need them, and so they are available now, and they're available as of today. Making them more broadly available, that's going to ultimately depend on private sector suppliers being able to source them and make them available.
And what about Kiwis travelling from Australia who might want to bring rat tests with them? Will they be able to do that, and will they be able to use them when they arrive?
Obviously, I'd encourage people, if they are bringing rapid antigen tests with them, to make sure that they're bringing ones that are approved for use in New Zealand, but we're not going to be searching every bag for rapid antigen tests.
So will you be finding people who don't upload their rat results?
What's the price that we're looking at for those rats? Because that work's we were told that the price was being worked on in November, and we still don't know. Do we know what the price is going to be?
Well, ultimately, it will be a market, so the market will determine the price, but we're looking very closely at whether that's a reasonable price or not. I don't know whether you have anything you wanted to add to that?
Yes, just to confirm that when rapid antigen tests become available through retail outlets, that will be through private suppliers, and private suppliers, they'll determine the price. We've got a pretty good idea of what we think is a reasonable price, and people
what would
will
that
have
be?
it. Well, somewhere between $8 to $10 a test.
Right, okay. And just in terms of one on boosters, you say we're at about 70% eligible have been boosted at the moment, and you're referencing the desired level. What's that, apart from 100%, which would be our ultimate, what is that desired level that you would want now, and also when we get to mid to late March when we see our peak?
Well, to be clear, we've done really well to get to 70% now, and likewise just approaching 50% of our 5 to 11-year-old children in a month have had their first vaccine, so as good as just about any other country. The more people that have boosters, the better for them, and the better for us getting ahead of and on top of this Omicron outbreak. So we have plenty of capacity, and anyone who is eligible should get boosted.
But what's that desired level?
As high as possible.
Yeah. One for the Minister, if I can. We've heard from, you referenced the support or the resourcing that's going to providers providing help for people isolating at home. We've heard from a number of Auckland providers that it's understood that the welfare side of it's going well. MSD are resourcing quickly, but for the health side, a number of Auckland providers, particularly Māori providers, haven't been paid for work that they've been doing since December. And it's understood that, they're characterising the hold-up as a bit of a tennis match between Ministry and DHB in terms of getting contracts out to them. This has been months that they've been doing crucial work that they haven't been paid for. Why is that, and is there work being done to rectify that?
I'm not in a position to comment on that. I don't have that detail, and that hasn't been brought to my attention. Certainly something that I'm happy to look at. We'll do a last sweep of questions to Jessica.
Have any MPs tested positive for COVID-19, and is that extraordinary given who they're meant to represent? Yeah,
not that I'm aware of. I know that MPs, though, are taking a lot of extra precautions in terms of what they're doing. So you'll see MPs, right the way across Parliament, being pretty conscientious around mask use, around those kind of public health measures. A lot of our activities now are being done in different ways. So my own constituent work I'm doing via Zoom rather than meeting people in person. So my electorate officers aren't having people coming in at the moment. And a number of MPs are doing similar things. Events, I think we're being a bit more selective about the sorts of events that we're attending just at the moment while we're in this peak, and I think that's probably fair to say of all MPs from right the way across the spectrum. But it is only a matter of time, though. I think we're bound to see COVID cases. If you look at MPs are travelling all of the time, they're out and about. It's only a matter of time, I think.
Minister, to the Director General, so 5,000 cases today, public health experts and the testing positivity rate suggest that it's an undercount. Do you believe that there's much more COVID in the community than the 5,000? And if so, what's a rough estimate?
Yes, we know, and even in earlier outbreaks we've known there have been more cases than perhaps our testing might show. I don't necessarily want to give a rough estimate, but our positivity rate today is about 11%, still well below what we've seen it go up to in other countries. I think Australia's is still, or New South Wales is still at about 30%. So it's a reasonable estimate, and again, as we get those rapid antigen tests out there with the higher incidence, and we will see those being more accurate, then that will give us a pretty good picture of the number of cases out there. I think something that, we can expect that there will be a significant number of cases we will never find because of many people don't have any symptoms, and so they won't seek testing in the first place.
Minister, do you fear we'll run out of rats?
No, I don't. I'm very confident in our supply, actually.
Minister,
Last two questions. We have one over here, one over there.
Just two more on rats. We don't really have daily updates or weekly updates anymore, so there's time for questions. Would you expect to put any kind of incentive in people to actually upload their rat results? New South Wales has a $1,000 fine if you don't upload your rat result. Is that at half New Zealand will go down?
I wouldn't rule things in or out at this point. What we're seeing already, if you look at the numbers today, we're already seeing a good number of people doing this. I think people, New Zealanders right the way through the pandemic have shown that on the main, they want to do the right thing. And I expect that overall approach is going to continue.
And on the rat supply, some people might not want to pay the $8 to $10 or possibly more if the market goes a bit crazy. But it'd still be illegal for free if they're symptomatic, right? So what's to stop them just going along to a pharmacy and saying, look, I have the fever? Would that be a problem?
Again, I think we're placing more trust in New Zealanders in phase 3 to do the right thing.
In terms of self-release, sorry, I just wanted to ask a follow-up on that. If people within a family, if more than one person gets sick, does that reset the family's 10-day period to 0? Could there be a family that has to self-isolate for 30 or 40 days if every member keeps getting it?
No, it doesn't. And since the start of phase 2, that has applied. So the 10 days for the household contacts starts when the first case is either diagnosed or their symptoms start. If the household contacts don't return a positive test, then they are released after 10 days, even if another household member subsequently turns positive.
Had you given any thought to regionalising the phases? There's been some people who've asked why, say, the South Island needs to go into phase 3 when some people would have preferred to have the phase 2 rules.
We haven't thought of regionalising it, and one of the things we've seen is that all areas of the country will move very rapidly in the direction. We saw Southern within the space of a couple of days go from a very low number of cases to one of our highest test positivity rates and one of our highest case rates in the country.
All right, thanks everybody.
Thank you.
Thank you.